Okay, so we just finished suctioning our patient, and at that point, while they're resting and reoxygenating, I would have performed another respiratory assessment to make sure that their lungs were clear and they sounded better. I also would have monitored their O2 saturation the entire time, and if it dropped below 90%, I would definitely break sterile technique and take care of their airway. That's the most important thing. So now we've done that, the patient is resting, and now I'm ready to prepare for tracheostomy care. For that care, I'm going to need my tracheostomy care kit, and I'm going to put it here. I am also going to need saline, and for these purposes, we're going to use this, okay? I always have an extra pair of sterile gloves just in case. I'm going to perform hand hygiene. We're also going to leave our ambu bag available right where we can get to it, and suction in case we need to suction them. But we're not going to attach the ambu bag to oxygen unless we have to. We're going to leave their trach collar on as long as possible. So the first thing I'm going to do is open my saline, okay? And turn the cap upside down, because I'm going to need to pour that one-handed in just a moment. Then I look at my contents of my kit. I like to think of this as, it may sound silly, but as going on a picnic. And this is the trunk of my car, my outside container. I'm going to open it. Inside my car, in my trunk, I have a picnic basket and I have a picnic blanket. Before I can touch anything in this kit, I have to put on my sterile gloves. These gloves are very, very difficult to get out and use. So always make sure you have an extra pair of sterile gloves. I've even fixed these and they may still be contaminated, so bear with me. I'm going to put my first one on. Then I'm going to come up underneath my other one. These are uni-hand gloves. You can turn them around in your hand to get them the way you need. They are not right and left. Okay, now I'm going to take out my sterile drape, which I said was my picnic blanket. I can touch it anywhere, but it does not need to touch any surfaces, and the bottom of this does not need to drop below my waist. So there is a slightly shinier side. I'm going to turn that next to me, and I'm going to turn this little blanket down like this. I'm going to come across to my table, not going over anything, and drop it. If I need to fix it, I can fix it in the middle. Now, 1 to 2 inches of this border is considered contaminated, so I can't have anything around that edge. Now I'm going to take out my picnic basket. In this inner tray, there are 4x4 gauzes, there is a drain sponge, there's pipe cleaners, there is a brush, Q-tips, and my trach ties. I'm going to put my small container, remembering my 1 to 2 inch border, closest to my container, my big container. I want to do everything in the way I'll lay it out the way I'm going to use it. And you can flip these from hand to hand to make this work, okay? My trach ties don't have to be sterile. So I'm going to put them right over there. And then my drain sponge is the last thing I'm going to use, next to the last. So I'm going to place it farthest away. First thing I'm going to use is going to be my brush. So I'm going to put it closest to my boat, my little container here. And then the next things I'm going to be using are my 2 pipe cleaners. So I'm going to place them next to my brush. And then I have 2 Q-tips. I'm going to place those next to my pipe cleaners. I'm going to need 1 sponge for drying. So I'm going to make my triangle, make another triangle, stand it up, and have it right there. Then I'm left with 3 gauzes. So now I'm going to come to the end of my table so that I don't reach over anything. With my non-dominant hand, I'm placing my 3 gauzes in here, in my large compartment of my large container. Now, I'm ready to contaminate one hand. So with my non-dominant hand, I'm going to come to my saline, palm to label. I'm going to lip. I'm going to pour half full in my large container, half full in my small container. And then I'm going to come back around and leave it. Now I can use this hand and my foot to move this table, okay? So what I'm going to do is I'm going to turn this and I'm going to reach in with my sterile hand. This hand is no good anymore, sterile-wise. So I'm going to reach in, I'm going to squeeze out my gauze, come back here, put it in my small container, squeeze out, put it in my small container. Keep that wrist cocked so you're not dragging over anything. Put that one in my small container, and I'm also going to wet my 2 Q-tips. And I'm going to place them in my small container. Now I'm ready to begin my cleaning. Bringing this over so I don't get everything out of my sterile or out of my peripheral vision. Now I'm ready with my contaminated hand to remove their oxygen device. And with my contaminated hand, touching only the part of the inner cannula that comes out, I'm going to remove the inner cannula. And then I'm going to grab my brush with my sterile hand, dip it before I put my cannula in it. I'm going to dip here, then I'm going to drop it into that and let it soak for a little bit. Then I'm going to pick it up just like I did a while ago, contaminated hand to the part that stays outside the body, and I'm going to, and this is hard, you have to really push. I'm going to go up in this way, get a little more saline, go this way, get a little more saline, and clean all of this. And then I'm going to toss my brush. Now, I'm going to put it in my other saline to rinse it, but I'm not going to let it go. I'm just going to kind of rock it to rinse it out. And if I need to tap it, I tap it on that inner part. Then I'm going to come to my pipe cleaners. I'm going to take one pipe cleaner, and we're going to go up this way to dry the inside. Toss it. Take our second one. Go from the other way, hopefully, without contaminating, to dry it out. We're going to leave the outside a little bit moist so it goes in easier. Bring my table back where I can see it. Now I'm ready to put this back in. And it follows the natural curve of the trachea. And I'm watching my O2 sat the whole time, okay? And it's still 92, 93. We're good. Now I'm ready to begin cleaning this outer part of this trach, okay? So I can touch this anywhere with my contaminated hand. I'm going to grab one of my sponges. I'm going to hold it as far back as I can. This may be where you have to get the patient to lean their chin back, or you may have to actually push it back. I may look a little bit violent here. Bear with me. Okay, I'm going to bring it, and actually we're going to bring his bed down just a little bit. If your patient can tilt their chin back, it's better. Okay, so we're going to clean away, one side, back two, and toss it. Then we're going to take another sponge, and we're going to do the bottom. So here, we're going to hold up. And you notice I'm holding far enough back on my sponge so I don't contaminate. We're going to go across and back. And I just contaminated because I touched my thumb on my contaminated hand. Now I'm going to take my third sponge and I'm going to do one swipe across and one swipe back. And I'm not using the same part of my sponge for either place. A separate part of the sponge is for each place. Now I'm ready to use my Q-tips. We're going to go around the stoma, and this is hard, y'all. You're going to clean, okay, toss it, take your second Q-tip, and I just reached over my field. I should be like this, okay? My second one, I'm going to come underneath, and on our faceplate, and toss it. Now we need to dry. So we're going to pick this up. Okay. We're going to go across, and I'm contaminating, and back across. Now I'm ready to pick up my drain sponge. At this point, basically, it's okay that my hand is a little bit contaminated. Right now, the only part that needs to stay sterile is this split in this drain sponge. So what we're going to do is we're going to place it on their chest. And now I can use both hands as long as I don't touch that inner V. And we're going to slide it up under the trach ties and the faceplate without touching that inner V. And we're going to bring it together. Now, again, if this patient becomes hypoxic at any time, we have to break sterile technique and we have to reoxygenate. Now, at this point is when we would change our either commercial, my sterile technique is over. We're either going to change our commercial Velcro holder or our trach ties. The thing I want you to know is that you never remove the old ties or holder until you replace the new ties and they are secured. That is finished, so now we're ready to put his oxygen back on. Oops, sorry. Okay, and now we're ready to clean up all of our supplies. This would all go in the garbage. Gloves off. Okay, side rail up, bed down, bed no lower than a 30 degree, and we would leave a suction catheter at the bedside. This would go in the linen, and then we would go document.